say obi eba hospital let's say obi visit mo the first place obeko a front desk call. Okay, so when the person comes to the front desk, you click on the OPD. Okay, and you click on OPD now, ebeba OPD new, ebeba patient view. Until first no be select OPD view. Okay, now I click on add patient. To click on add patient, say patient no hospital like waba ho dada. So waba ho dada, obebo ebia ne phone number na ne din. Nti obodi ne ma create demo account patient nti obodi ne ma na type the patient ne din ne beba. So when you tap on it, when you click so ape, once a load the patient ne din ne or some few informations what patient no. Symptoms or the bar sada no. Now I type this box mo. From Ofiwa now about note. So you put the note here. Any note here you have for the doctor. If the person have any allergies, you put that allergies here. Now, the time the person came in, no, over set appointment time no has any date no has. So when you click on it, the system will automatically pull the time and the date of that day until you just click here and then you click out. Okay, now you just write a case number or a case name. Maybe I'll be to need the nipa ne din no a case name no. Maybe in this case I did demo patient. Maybe I'll be a demo patient case 2 and case 1. Okay, now if the person is an old patient, send them select and I know I by yes ewa. 2 by yes sir. Now the most important things no, you can ignore the reference and the apply TPA. Apply TPA is here for ABS insurance, and as if you take insurance or click here apply to insurance. So when you are done, I'm able to claim more insurance. But since you are not doing insurance, you leave this side alone. No about a selected consulting doctor. Okay, so in this case you can choose Dr. Charles Ameni. I have done a demo doctor here already, so because this is a demo, I will choose the demo doctor. Okay, we are now clicking on charge categories. The charge categories, we've currently only set OPD charges because the person is at the OPD. You just choose OPD charges. Okay, no about the selected charges no, you just do OPD charges again. Automatically the system will put in your standard chart, which is 80 cedis for the OPD. Okay, so when it puts it in, all you have to do is to just save it. So as soon as you save it, this goes to the doctor. Okay, as soon as you save it, the doctor will have access to this. Okay, now if the person is a new patient, it's still the same process. The only thing is that you click on add patient. Instead of searching the patient's name here, you just click on new patient. You click on new patient, you put in their name here, and then you select their gender, their date of birth. Okay, so you select the date of birth. As soon as you select the date of birth, this particular section will be filled automatically. Okay, if you know the person's blood group, you click and add it. If you don't know it, leave it alone. If you know their marital status, you can add it here. If you don't want, you can also leave that one alone. Okay, the most important thing here is the phone number and then the email. Okay, you should know their address as well, so you ask them to give you their address. So when you are done, you just save it and you do the same process as we did earlier. So let me just do another demo user. Demo user 2. So gender male. I've already set the date of birth. So marital status, let's do it single. and let's do the email. You can leave the email as well, but the phone number there is important, so put the phone number there, 0240-428-030. So you just basically do these things and then you click on save. So as soon as you save, it will be shown here, and then you do the same process as we did earlier. You click on the appointment date, it will automatically put it inside for you, and then when you come to the case, you can do demo user 222 case 1. Okay, since this is a new patient, you just leave this side alone. You leave the reference and then the apply TP, which is for the insurance alone as well. Then you choose a consulting doctor. In your case, it will be Charles Ameni. Okay, but this is a demo, so I'll use a demo user. Now you still come and choose the charges, and then you choose charges again, and it will put in your standard charges. Then all you have to do is just save it. That is all you have to do to book in a patient. Okay, so now the patient is in our system, which is this patient now. Okay, so when you click on the patient, if you want to take vitals, let me go back again so that you see it well. So now this is the patient, okay, the new OPD patient. So to take vitals, you click on the patient, and then you go all the way back here and you click on vitals. So when you click on vitals, all you have to do is click on add vitals. Okay, now the vital section, we have vitals name, vital value, and then date. So on the name, you choose the kind of vitals you are checking. So in this case, let's say we are doing height. Let's add another one. We are doing pulse. Let's add another one, which is let's say BP. Okay, so we are doing these 3 vitals. The person came in today, so we put in today's date by just clicking on the date. Okay, just clicking on the date and clicking out. Now when you check the vitals, you put the values here. Okay, you put all the values here. So when you are done putting in the values, you just click on save. So in this case, the height is from 1 to 200 centimeters. So let's do 20. And then the pulse, we have 70 to 100. So let's do 60. And then BP, we have 90, 60 to 140, 90. So let's just do 90. Okay, now all we have to do is just click on save. Okay, so as soon as you click save, the vitals of the person will be saved with the date. Okay, so now this is the person's height, the person's weight, pulse, temperature, BP. Okay, because we didn't check RBS, FBS, and then respiratory, all of them are saying 00. But since you do them, you should add any vitals that you check as well. So as soon as you do this, all these informations will go to the doctor, and the doctor will have access to all of them. Okay, now if the person is on any medication, the doctor will add them here, so you will see the medications here. You can also add them by the doctor's instruction. Okay, the person's labs will show up here. All the labs they have done will show up here. If they did any operation at your hospital, it will also show up here. Any charges they have incurred since they came to your hospital or your facility will show up here. In this case, there is the standard OPD charges, which is 80 cedis. That is here as well. Okay, if they make any payment, the payment will show up here as well. Okay, this is for life consultancy, which is not being used currently. All right, now if you want to look at their treatment history, you click on treatment history, and it will show any time they came to the hospital. When you click on the show button, it will show you what they did that particular day, any test whatsoever they did. So basically this is for the OPD. This is how you add somebody to the, like when somebody comes to the hospital, this is how you put them into the system. Now let's say a person is scheduled for a visit, or let's say a person is scheduled for a visit or a checkup. You click on visit, okay, and then you come to new checkup. So when you click on new checkup, it will already bring the patient, that day's symptoms. If they came with any symptoms, you add it. Now it has already put in the appointment date, okay, so you put the case here if you want to. If you don't want, you can leave it as it is. Because it's a checkup, it will automatically select the doctor that the person came to see the previous day. Now you choose the charges again, okay. We will add checkup charges as well, that is per your administrator's instruction. If there is any charges, as soon as you click at this side, you will see them. This is for only OPD, so if there are any other charges, they will show up here. All you have to do is click on it and it will just come into the system. So after selecting all this, you just click on save and the information goes to the doctor. Thank you.